Welcome to Celebrate Aging. I'm Vicki Marthaler, your hostess here today, and I am with Marita. Marita, that's kind of different.
Thanks.
I like it.
Thanks.
It took me about 2 weeks to figure it out, to make sure I wasn't saying Maria or Marie or Mary. It was Marita.
Yes, it is.
And Marita is our admissions specialist, which is another interesting title. Tell me about that.
Well, on our campus, my title is to make sure that the residents or the referrals get placed in the appropriate setting. So occasionally I am looking at residents that might actually need to be in the assisted living, or they might need to be in the memory care or long-term care or our short-term unit. It's a variety.
And that reminds us, Ecumen Detroit Lakes is a campus, and we have many facets to our campus. And so an admission specialist is a good deal because you know what is needful for the person, because you go usually to a hospital and check on people who are undergoing surgeries or being referred to by doctors. And so you need to know what we do at Ecumen, right?
Yep, my role is to actually meet with the physicians, to meet with the families, to meet with the hospital case managers, discharge planners, to make sure that families are aware of what their options are, because there's a lot of different facilities out there, and that you have a choice, and to make the right choice for what's appropriate for you. And so what I do then is I educate on the services that we provide on the campus, from even our home health to our adult daycare to, what you might think is appropriate, what you think your needs are, maybe not, or what somebody's telling you might be what's good for you. In the long run, after listening to what you're telling me, we might be able to make some different suggestions for you that might be more appropriate for you.
I think it's really important too. One thing that Marita and I have talked about before, and other people have, is that choice is very important. That people who are looking for services need to know their choices, need to know their options. And sometimes people get a little confused about that they feel like, well, I'm in this hospital, and this hospital has a different campus that I should go to because my doctor is there. And sometimes Emmanuel isn't affiliated with any specific hospital. We are open to all different
Yep, we
hospitals.
actually, which was pretty exciting for me when I ended up doing the statistics for last year, we have patients that have come from all over the area, from Fargo, from Detroit Lakes, from Perham, Park Rapids, from Minneapolis, Brainerd,
wow.
Grand Forks. We get a wide variety, and a lot of our referrals are driven by the fact that we are a campus and that we have a lot of great outcomes, a lot of word of mouth. The physicians that we have on campus now are affiliated with both Essentia and Sanford.
Great.
There are some independents that can come in if they so choose.
Nice.
So
there's an openness. There's an openness at Ecumen Detroit Lakes.
Absolutely.
Yeah.
It's about your choice. It's about the opportunity to choose what you want to do. Even if your physician does not come to the campus to see you on the campus, you do have that right to go off campus to the clinic and be seen if you're capable of doing that. It's about choices, being able to choose what's the best for you,
right,
what you want to do.
And Ecumen Detroit Lakes has so many. We do have a short-term stay. We've got a great therapy department, and so it's important to know that of all the options that we have here, and like you said, we have memory care, we've got assisted living, we've got home health. We kind of got it going on.
We've got it all. With you could start out with the adult daycare piece of it and transition all the way through into that long-term care side.
Nice.
Yep.
That is nice. So we have choices here, and we want you to know about them. And I remember, like, I've been with Ecumen Detroit Lakes when it was Emmanuel Community for over 18 years. And I remember that people sometimes thought that this was the Lutheran nursing home, and that things were divided up by churches. And you know what? That isn't like that anymore. We are a faith-based community. That means our roots are in the church, but we are open to all faiths. And I know, like, I can tell you that we have Mass weekly at Emmanuel. We have communion ministers that come weekly to Emmanuel for our Catholic residents. We have Lutheran ministers that come with communion as well as services. We have Assembly of God. We've got a Methodist. We have congregational offerings. We have a wide range, and we even embrace people of non-faiths. That's the great part. And if you have we've had some residents who appreciate the native heritage
Yep.
and their offerings, and we welcome people of all faiths or non-faiths. And so that's one of the things that has changed over the years. I remember too, funeral homes too used to be this was the funeral home for the Catholics and this was the funeral home for the Lutherans, and that has changed over the years. So we need to expand and broaden our expectations and our perceptions, because
Yep.
I want to tell you that Ecumen Detroit Lakes is open to all faiths or non-faiths, as well as open hospital-wise too, that we aren't just
Choices.
choices. We have choices, and we want you to know about that. So if somebody's in the hospital or somebody's, maybe there's a family member looking for services, they would call and talk to you, or the doctor would? How does that work?
The best way to do it is talk to the discharge planners or the case managers at the hospital. Everybody in the hospital is assigned a case manager or discharge planner.
Is that like a social worker?
Yep,
Okay.
social worker.
So case manager and social worker, sometimes you use words I'm not so sure I know what they are.
That's
Help me out.
Every hospital differently. Some use different words.
Okay.
Yeah.
Okay.
And then talk to them. They're the ones who would have to make the referral to me, so I have access to determining what's the best level of care for them at that point. And because I'm in Fargo and I'm in Detroit Lakes and I work with them in the surrounding areas, a lot of them know me by name. And just tell them that you want the referral made to Ecumen Detroit Lakes, and we can go from there. And I will come up and meet with you if that's what you want, or you can come to the campus and we'll give you a tour and sit down and chat with you, and to determine what's the best level of care. Again, it's all about the choice of what you want, and knowledge is power. So as
Yes,
soon as you
yes.
think you might need that
Yes.
information,
We've got information.
come get it. You know, it's better to get the information before you need it than when you're in the middle of that situation and trying to figure out what you need to do in that crisis.
Great. And bring your family person with. You know, we want to talk to families and get the full picture of the scope of what is needful. We want people to be successful. We want them to be safe. We want them to be well. We want them to be healthy. So,
Absolutely. Our length of stay on our rehab unit runs about 25 days. And with that, we don't do strictly just rehab. You know, we take patients on there that have some wound care issues, or we have some that maybe need respiratory care.
yes.
It's a little bit more than just somebody rehabbing from a knee surgery or a hip surgery or situations
Right,
like that.
right,
So
right.
again, it's ask, you know,
Yeah,
see
ask
what your
questions.
options are.
We would love to tell you all the different choices and all the different services that are available. And sometimes we get really creative.
We're very creative, very,
Uh-huh.
very creative. And that's the fun part of my job, is being able to help you out and meet the needs that you have,
Mm-hmm.
and what you think is best for you. It's not what somebody else is telling you. Yeah.
So we want choices. We're lifting up choices today. We want you to know that at Ecumen Detroit Lakes, between the nursing home, and which also has short-term and long-term services, adult daycare, home health, assisted living, memory care, wound care, respite care.
We got it all.
I have more fingers, but I'm running out of the words. I want to find the right words. But we certainly want you to know that Marita is here as an admissions specialist to talk to people about what is needful in their life and how Ecumen Detroit Lakes can serve you and serve your family. We have options, we have services, we are available here to visit with you. So Marita, you said sometimes you're in Fargo, but you do have a telephone number. Can you give that out, or how does that work?
The easiest way is to call Emmanuel and ask for admissions, and they will be able to redirect to my phone.
Okay, and so Emmanuel's number is 847-4486. And you can certainly call and ask for admissions, ask for information, ask for a social worker, ask for a caseworker. There's lots of names going on here.
Yep.
But we will find out what you need, and we would love to talk to you. You have a good day. Remember, Marita's here for you as well as me at Ecumen Detroit Lakes.